Hi, this is Dr. Broussard again. I wanted to show you this because in selected cases I have been recommending specific types of meditation for people because of the impressiveness of the medical literature that I see on how much the mind affects the body, and it looks like according to some of the gastrointestinal specialists, they're starting to find out the connection between the mind and the body. And just this week, May the 9th, 2011, there was a doctor that was delivering a report on the impressiveness of the improvement of people with irritable bowel syndrome, IBS, and they're using mindfulness meditation. It's a specific type of meditation, and the results are pretty impressive. So let's kind of listen to this. He's got a strong accent, so you're going to have to pay attention closely at the beginning, but then you kind of get used to it. So let's go see if we can take a look at the introduction of what Dr. Paulson has to say.
I'm Dr. Robin Chutkan from Georgetown University Hospital, and I'm delighted to have you here joining us for this DDW press conference on an issue that's very dear to me, the relationship between the mind and the body, something that physicians seem to be just waking up to. Research is finally beginning to catch up to this idea of the mind and body being connected, and there are a number of psychological issues that can play a really crucial role in the severity of gastrointestinal illnesses. These symptoms are very real to the individuals who experience them. We have some fascinating data today from 3 investigators that really illustrate this mind-body connection as it pertains to gastrointestinal illnesses. The first investigator we're going to hear from today is Oliver Paulson, who's a PsyD and associate professor at the University of North Carolina. Dr. Paulson is going to discuss how mindfulness meditation may have a therapeutic impact on irritable bowel syndrome, a disease that affects up to 15% of the population and which frequently defies more conventional pharmacologic therapy. Next, Arvind Srinath, MD, who's a pediatric. Dr. Paulson, can you start us off?
Yes. The aim of our study was to look at mindfulness training as a method to improve outcomes for IBS patients. IBS is a common disorder, as mentioned, and it has proven difficult to treat effectively for many patients. Up to half of all IBS patients do not get satisfactory improvement in the symptoms in spite of the best medical care in conventional care. So other methods have long been sought to improve those outcomes, supplemental treatments, and among those psychological treatments have proven about the most effective to help boost the outcomes in terms of improvement. But typically these have been clinical treatments like cognitive behavioral therapy or hypnosis treatment that require treatments for therapists. But mindfulness training has been gaining popularity nationwide in the recent years, but has not been tested for this purpose in IBS. So we wanted to see whether that type of meditation could help improve the symptoms of IBS. So what we did was we divided 75 women with IBS into 2 groups randomly. One group received an 8-week course of mindfulness training, and the other group received support group therapy, where they supported each other basically and discussed various aspects of IBS. And in the beginning of the treatment, we measured how credible subjects thought that this would be as treatment for IBS, and we found that the groups were no different in their expectations of benefit from the treatment, which was good. And then we completed this 8-week course of treatment. Both groups completed 8 weeks of treatment, where they met for 2 hours each time and also did a half-day retreat. This is pretty standard for mindfulness training, so we had the same format for the support group. At the end of treatment, 2 weeks later, after they completed this course, they were measured on outcome measures, and then again 3-month follow-up. And what we found was, in a nutshell, that the gut symptoms of the patients in the mindfulness group improved substantially more both at 2 weeks after end of treatment and also a 3-month follow-up. And this was a pretty big difference. The overall IBS severity score, which is measured with a validated scale, the IBS severity scale, was reduced by a quarter, or 25.4%, in the mindfulness group at the end of the treatment, but only 6.2% in the comparison group, the support group. And at 3-month follow-up, this had increased even more. So the IBS group that had received the mindfulness training was now had now reduced their overall symptom severity by 38.2%, but in the support group, the reduction was only 11.8%. So substantial difference. And at the 3-month time point, we also found that quality of life, health-related quality of life, had improved significantly more in the mindfulness group compared to the support group, and their psychological well-being was also improved more compared to the support group. So the bottom line seems to be that in a well-designed comparison with an active comparison group that receives an equal amount of other type of intervention, mindfulness seems to have a specific effect to reduce bowel symptoms and also improve quality of life and reduce psychological distress. And I think for me the most exciting thing about this is that doing something as simple as just changing the focus of awareness on a immediate experience can actually substantially improve bowel symptoms in this hard-to-treat gastrointestinal disorder. Thank you.
Thank you so much, Dr. Paulson.
So to me, that's pretty impressive in terms of the improvement of a gastrointestinal problem improving with mindfulness meditation. Okay, so if you need to have more information about that, please contact me. And this is Dr. Broussard, watching your back.